The impact of the coronavirus emergency is everywhere across Sonoma County. Cars lined up for food at most every distribution site, eerily quiet streets, volunteers stepping forward to pack food boxes and create virus protection kits for the homeless. But for the vast majority, the major impact on lives has been the shutdown, an essential step without universal testing to ensure the virus spread is contained.
Shelter in place has been much more effective even than we predicted.
And what about that curve? Well, where early models indicated a need for perhaps 10,000 beds in Sonoma County, the reality has been far less here and across the Bay Area. Of 180 cases so far in Sonoma County, 12%, or about 22 patients, have required hospitalization. Clearly, stay-at-home orders and social distancing have paid off.
We continue to have slowed down the rate of growth. We have bent the curve. It has begun to flatten, but again, it's not moving in the direction that we are ready to ultimately celebrate.
In fact, as cases have gradually risen to 180, the number of active cases in red has remained relatively constant. No surge yet. This as many patients in green have recovered. But public health and government officials will also admit models are best guesses based upon assumptions, changing with new data and often a tool to plan for worst-case scenarios. In Sonoma County, that has meant finding and preparing an alternate care site to accommodate 500 or more patients and vulnerable individuals in case of a local surge. This past week, the National Guard hard at work at Sonoma State preparing dorm rooms for vulnerable people, those with nowhere else to isolate, including some of the county's unsheltered.
They are loosening those rooms of furniture so that patients can be prepared to go into those dorms.
And 2 gyms set up for an influx of up to 88 mild and moderate coronavirus cases, patients that may or may not arrive. All of this comes as new data, changing models, have cut the expected surge from 1,500 beds to between 600 and 1,000 and pushed the peak out into June. Whether a local surge will come, still unknown. The well-respected Institute for Health Metrics model of the University of Washington predicts death rates to soon fall across California, but no one can say what will happen when restrictions are eased. For public health officials working in real time with evolving data and lives at stake, the best course is often the most conservative. In Sonoma County, Carl Van Emberg for News of the North Bay.